Welcome back. We close Chapter 5 with two topics: the so called difficult patient and the dentist online. First, reframe the label. Difficult describes the interaction, not just the patient. Behind difficult behavior is usually fear of the dentist, pain, prior trauma, dental trauma is remarkably common, or shame about the state of one's teeth. Curiosity and patience de escalate more reliably than authority. The most useful first question isn't, "What's wrong with this patient?" It's, "What's going on for this person, and what's my part in this interaction?" That said, sometimes ending care is right. For persistent non adherence, abusive staff, or irreparable loss of trust. But do it properly: written notice, emergency coverage for a reasonable period, and access to records. Simply dropping a patient is abandonment, unethical, and legally actionable. Now, the digital dimension, the material most likely to catch you off guard because the norms are still forming. 4 pressure points. Patient photographs, before and after images require genuine, specific, revocable consent. A general intake form is not enough, and the patient can change her mind. Reviews. This is where dentists most often err. Confidentiality limits how you may respond even to an unfair public review. You cannot disclose that someone was a patient or discuss their care. Viral content. The spectacle of a dramatic case can reduce a vulnerable patient to entertainment, and the asymmetry: a patient may post whatever she likes about her own experience. You remain bound by confidentiality. You cannot respond in kind. Then the friend request, genuinely awkward, because declining can wound a patient who meant kindness, while accepting collapses professional distance. There's no rule that fits every case. What matters is a considered personal policy, decided in advance, applied consistently, so no patient feels singled out. A separate professional page is one clean solution. And be careful: following a patient's account can shade into surveillance. The sentence to carry: protecting the patient's trust through boundaries, confidentiality, and a considered presence online, is itself a central ethical task of practice. Next, Chapter 6, and the hardest question in the book: who gets care at all?